A devastating health crisis is rapidly unfolding, with over half of the world's adult population and one-third of children and young adults predicted to be overweight or obese by 2050. The projections, based on an extensive global study published in The Lancet, paint a dire picture of escalating obesity rates, particularly in low and middle-income countries. If these trends continue unchecked, the consequences for global health systems, economies, and overall life expectancy will be catastrophic. By 2021, nearly half of all adults worldwide, over 2 billion people, were already classified as overweight or obese. This number has doubled since 1990, and the trajectory suggests an even steeper rise in the coming decades. If no immediate action is taken, 57.4% of men and 60.3% of women will be overweight or obese by 2050. Countries like China, India, and the United States will see the largest absolute increases, but the most alarming surges will occur in sub-Saharan Africa, where obesity rates are expected to more than triple. Nigeria, in particular, faces an overwhelming crisis, with its overweight and obese population predicted to explode from 36.6 million in 2021 to 141 million by mid-century. The burden on already fragile healthcare systems will be immense, stretching resources far beyond their limits. The study underscores that this trend is not only continuing but accelerating. Obesity rates among children and young adults have already doubled between 1990 and 2021, and by 2050, 1 in 3 young people will be affected. This signals a future in which entire generations are at increased risk for chronic diseases such as diabetes, cardiovascular conditions, and certain cancers, many of which develop over years of excess weight and unhealthy metabolic conditions. The long-term effects will ripple through societies, driving up medical costs, reducing workforce productivity, and shortening life expectancy. Governments and public health officials are being warned that immediate, large-scale interventions are the only way to prevent this disaster. The lead researcher, Professor Emmanuel Gacadou from the University of Washington, did not mince words, calling the obesity epidemic a profound tragedy and a monumental societal failure. The global failure to control obesity reflects deep flaws in food systems, urban planning, economic policies, and public health strategies. Unhealthy, ultra-processed foods remain cheap and accessible, while fresh, nutritious alternatives are often priced out of reach for low-income families. Sedentary lifestyles, driven by modern work environments and digital entertainment, are exacerbating the problem, particularly among young people who now face obesity at rates never seen before. While new weight loss drugs like Wegovy and Mounjaro may offer some relief for individuals, they're not a solution to the global crisis. These medications are expensive, difficult to access for most people, and fail to address the root causes of obesity: poor diet, lack of physical activity, and systemic food industry failures. Relying on pharmaceutical interventions instead of prevention will only deepen health inequalities, as wealthier individuals gain access to weight loss treatments while lower-income populations continue to suffer the full effects of obesity-related diseases. The warnings are clear. If no drastic action is taken now, the world will soon face a catastrophic health disaster. The rapid spread of obesity will not only lead to an explosion in chronic illnesses, but will also cripple healthcare systems, drain national economies, and lead to massive societal costs for future generations. The current trajectory is unsustainable, and without immediate intervention, the global population is heading toward an irreversible public health collapse. The time to act is now. Governments must implement aggressive policies that regulate the food industry, make healthy foods more accessible, and encourage physical activity through urban planning and education. Without urgent, sweeping measures, the world is on the verge of a preventable catastrophe, one that will define the next century as the era of obesity-driven disease and suffering.